Well, welcome everyone. We're thrilled that such a large crowd is here for our steering committee meeting, and also in particular to hear from our special guest, the former mayor of Rockford, Illinois. We'll be introducing former Mayor Morrissey appropriately in just a moment. We want to first do a little bit of housekeeping with our minutes from the last meeting, but for our guests, I'm Roseanne Haggerty. I'm the chair of the committee, and maybe we can all quickly go around and introduce ourselves and either the institution we're representing or identify ourselves as a community representative.
I'm Jim Schlosser. I'm the City Council representative on the steering committee.
I'm Val Guy, the executive director of the Friendly Kitchen.
Karen Miss Williams, Concord Human Services Director.
I'm Laura Simoes. I'm a community representative.
Rabbi Robin Nafshi, I represent the faith communities. Gwen Whitney Gill, I'm the community health coordinator at Concord Hospital.
Ruth Parancevich, a community representative.
Byron Champlin, it says here I'm mayor.
Larry Morrissey, guest.
Tom Furtado, I'm the CEO of Catch Neighborhood Housing.
Tim Sink, Greater Concord Chamber of Commerce.
Peter Shermanis, community representative.
Well, thank you all for joining us. And maybe someone from the committee could make a motion on the May 16th meeting minutes that you received. First of all, any corrections or additions?
I'll make a motion to approve the minutes.
Okay, a second?
Second.
Okay, thank you. Jim, all in favor?
Aye.
Aye. Thank you. Well, that leads us to really a wonderful opportunity we have to hear from former Mayor Morrissey, who, as mayor of Rockford, Illinois, was the first, Rockford was the first city in the country, and under former Mayor Morrissey's leadership, he was the first mayor in the country to achieve functional zero veteran and then chronic homelessness. And Rockford, population, I think 150,000, is one of the communities on course to be the first to reach functional zero for all. It's a daily commitment. It's not like it's a goal you achieve one day and move on, but we're thrilled that Larry's travel schedule could bring him to New England, and that he'll be able to share with us what had to happen, I guess, what shifted in Rockford to allow them to make this kind of progress and sustain this kind of progress. So I will.
So could we just check with Concord TV that we're
Okay.
recording? Could you just ask my?
Concord TV,
You're all
we're
set?
good? All right.
Thumbs up. Okay.
Okay,
I guess
terrific. And
okay.
we thank Concord TV for being here to create a taped record of the conversation that we can share with others in the community. So with that, and I should, by way of just some disclosure, the organization, I'm here as a community representative, but the organization that I work for in my day job had the real privilege of working with Rockford on some of this work, but the success is all Rockford's. But if you hear a reference to Built for Zero or our work, that is the link, and that's how I was able to connect with Larry many years ago. So
Thank you very much. So I'm half Irish and half Italian. I like to use my hands when I'm speaking and move around a little bit. Is there a microphone that I could walk around with? If not, I'll just use this one.
He has to just connect it.
Mm-hmm.
All right. While he's doing that, I'll jump in and just say what an honor it is to be here. And Roseanne, you're very humble, but I would say the work that Built for Zero Community Solutions did in supporting our journey was instrumental and continues to be so. I would also just say that I love local government. I am a recovering mayor, also a recovering lawyer. Don't hold those designations. Thank you very much. Please try not to hold those designations against me. Is this working? Yeah. Can you hear me? Yep. I love local governments. Every local community is different. What I'm going to describe to you worked for us. I'll give you some of the background and the circumstances of Rockford, Illinois. But I would just say I would be cautious to don't think that what worked there is necessarily going to apply directly to your community. I think some of the principles probably will, but I'm happy to answer whatever questions, brainstorm with you. But just know that once you've seen one local community, you've seen one local community, right? Every community is different. And so I'll share a little bit of our story, and hopefully it might be helpful as you continue your important work. So I'm going to probably stand over here so I could direct attention to the screen. and just talk a little bit about, I've given this talk once or twice before, and so I'm sharing with you materials that I really try to use as educational. And so some of the topics and learning objections have to do with, and material discussed today has to do with Rockford, our community context, a little bit about how my journey and our organizational journey on population health for our city employees ultimately had an impact on how we did population health when it came to homelessness and other city initiatives. Lessons learned, I'll hit you with the punchline right now. The two most important things for us ended up being, in hindsight, data and governance, having credibility with our data around homelessness, building our by name list, and then ultimately having a governance structure. A little bit about, again, how the lessons we learned on homelessness and what we were dealing with our city population ultimately has impacted how we looked at a number of community-related problems. And I've got some additional material in here. And by the way, I'll make this material available to you, Roseanne. You can share with the group afterwards. So this is Rockford, Illinois, our downtown riverfront. As Roseanne mentioned, Northern Illinois, about 150,000 people, about 350,000 in our area of coverage within the 2 counties that made up our community action agency. Unlike probably most areas of the country, Rockford's, our human services department, also was the entity that ran our 2-county community action agency. We're also the grant recipient and fiscal agent for our homelessness continuum of care funding. And we had a number of consolidated services, including also things like energy assistance and Head Start, that all came under the auspices of the city as a human services department. And by the way, any questions that come up during my presentation, feel free to interrupt, ask questions. And I would say the last little bullet point there, it's not really tongue-in-cheek, but it should be kind of funny, because I think one of the other community characteristics that typified us, and I'll go into some detail on this, was a mindset and a culture of silos, distrust, and scarcity. I would say that was the case, that was the culture within City Hall and our agencies, as well as our community nonprofits, and frankly, even a lot of our business community and other community partners. You know, maybe it was a little bit how I managed to get elected as a 35-year-old, the first independent elected in the city's history. There's just a lot of chaos and disruption. I saw opportunity in that, and that's how I got elected. But it wasn't easy. So I'm going to take you just real quickly through a little bit more in the community context. This was a headline in the Washington Post when I was in high school, 1983, or an excerpt from an article in the Washington Post that says the following: "The old American dream of the 50s has been realized here, and it's slowly crumbling because the checks aren't coming in anymore," said Glenn Turnpoff, who runs the Northern Illinois Building Contractors Association. "The ability to work with your hands was once the cornerstone of this town," he added. "There just aren't as many hands needed anymore." Rust Belt City. In 1973, we were among the wealthiest communities in the country per capita. A decade later, this is what we were dealing with. Highest unemployment rate in the nation around this time, struggling. And when I was in high school, if you did well in school, the kind of message was go to college, do well, and never come back. That's your reward. I came back and got elected. And this is some of the headlines that I was dealing with as the mayor of, at the time when I was first elected, Illinois' second largest city. Rockford named number 3 on Forbes' miserable list. Rockford, one of the worst cities to live in, according to one study. Welcome to Rockford, the underwater mortgage capital of America. I was actually featured in that Wall Street Journal article, front page of the business section, in front of one of my, I had 2 ultimately, but one of my underwater mortgage homes. Rockford listed as America's 5th most dangerous city. And this probably one of the most humorous ones. Rockford, one of the fattest towns in the United States. This was a Chicago news outlet. And the little title there, you might not be able to see it, is just like kicking you when you're down. It says, residents of Rockford, you are fat. That's just gratuitous. Like, why does the news article get to say something like that? But anyways, we're a hard town. I mean, there's a lot going against us in Rockford, Illinois. And then the lead up to us making me accepting the challenge to end veterans homelessness, this was in the papers in the spring of 2014, this article from March 25th, 2014. Rockford pastor fighting city order closing the church warming shelter. So we had a report come in. There was an emergency at a church. Our paramedics show up. Somebody's in distress, needs a medical transport, and we find out there's an illegal shelter being run out of a church. That began a process. So they were essentially running an overnight shelter, and they weren't permitted to do so. One of the more difficult things you have to do is try to, whether you're trying to keep people safe and housed, is to be able to have to say no at times, which we did. It was an illegal shelter. It was a hazard. It was a risk to those that were staying there. It just wasn't effective ultimately in trying to get people housed. So we had to say no. They came to city council one Monday night that I won't forget with 25,000 signatures in a petition. This is an article from the Rockford paper. I was being called every name in the book. People, public speakers lined up. Were being threatened with lawsuits at the time. Ultimately, we still went forward and shut that business down. We're also inviting the pastor of that church to join our local continuum of care to try to help, but it was an extremely difficult environment. Got even more difficult 2 weeks later when this was the headline in the paper. 2 dead in Rockford house fire. In an abandoned home, 2 homeless individuals end up dying as a result of a fire trying to stay warm in the winter. This was probably about, and we had other sad cases like this, but given the context that we were just coming out to, this was one of the definite low points. And it, caused me to question myself and what we were doing. And, did we cause these deaths? So I'm going to switch gears for a minute. I alluded to a little bit at the start of my talk, and this ended up being, I never thought about it at the time that it would be, but one of the more important things that led to my epiphany on what ended up being successful for us addressing homelessness actually started back in my first term. So that article you saw was from my third term, 2014. I'm taking you back to 2005. I just got elected. We were, I was new to the office, never held elected office beforehand, and I get a knock on the door from our CFO, from our legal director, from our city administrator. Hey, Mayor, we're getting ready for union bargaining. We got to have a conversation. About what? Well, the health fund is underwater. What you should see here is a projection of what we were spending on healthcare at the city, and it was out of control. Our healthcare spending was out of control, and we needed more investment from our labor groups, fire union, police union. We were asking them to pay more on premiums. Everything in Illinois is bargained. We have strong organized labor. I never was anti-labor, but I also had to work to try to balance our budget. Needless to say, super difficult, challenging time. Ultimately, we got through that time period, ultimately got our union groups to contribute more, but guess what? Our costs kept going up. We started realizing, this was in my first term, that leading in my second term, that it doesn't matter how much our employees contribute to our healthcare spend. If we don't actually improve health outcomes, we're still going to go broke. But sadly, from my own personal experience, I knew if I was having difficulty getting a primary care appointment for myself and my family, if I had difficulty navigating healthcare, how about everybody else that worked for me? So in my late second term, then started my third term, we did our consultant, healthcare consultant, convinced me to say, hey, Mayor, let's think about doing our own primary care. Like, well, isn't that what our hospitals do? It's like, well, yes, but they're busy running a hospital. They're not really focused on, they don't have the staff to get people in when they need to get in. We may want to think about doing our own primary care. And so we actually went out to RFI, then RFP process, and ultimately hired the company that I now work for called Marathon Health. And the model for population health that I learned about to take care of our city employees ultimately became super important for taking care of our homeless population, believe it or not. Marathon Health and other entities like it operate using what's called a population health model. And instrumental to that, what I saw during my learning process was creating a by name list. If you're familiar with that term in homelessness, guess what? If you're trying to identify your chronically ill folks, you need to know, do they have diabetes? Are they pre-diabetic? Do they have heart disease? They have high blood pressure. And so Marathon Health had showed me through that sales process, frankly, here's how they manage population health. Why that's important is because I ultimately came to realize that that kind of model might work for other aspects of the city's work. One quick slide here. Here's the proof in the pudding. So on the healthcare side, we after opening up our own clinic for our city employees in 2014, we have seen tremendous savings. This is from a year-end review that we did for the city of Rockford just in December of 2023. Our year 9 claim savings against what our expected spend was over $6 million, cumulative savings over $44 million. So the question is, can a population health approach work for other types of activities that local governments are involved with? Well, here's what we were here's what, again, more about the context I was dealing with. This is, by the way, a depiction of me. This is a cartoon in our local paper. It was around an editorial accusing me, well, I'll go through the cartoon frames here and you can see what it was accusing me of. The first frame is me saying, I don't like the way the schools are run. The second one is, I don't think our judges are tough enough on criminals. Then the third punchline here is, hey, look, this is Santa Claus, me on Santa's lap with an elf watching. How about you just stick to being mayor and I'll decide who's naughty and nice? So you talk about collaboration and trying to get community partners together. This is the context we're dealing with. So this is coming from our editorial page of our newspaper. And the editorial that they wrote alongside of it was even worse than the cartoon. Like essentially stay in your lane, just do your job. Well, how do you do that if you've got a complex problem like trying to educate your children, trying to deal with violent crime, or even arguably more difficult, trying to reach zero for homelessness? Fast forward from that to 2014, the First Lady, along with U.S. Conference of Mayors, announced this challenge to end veterans homelessness. By this time, I'd been in office for almost 10 years, and I was pretty cynical when it came to homelessness. We had a 10-year plan. We'd been doing point-in-time counts. We really were trying to get everybody on a common HMIS system. We were getting nowhere. So when I was first approached about accepting the challenge to end veterans homelessness, I was like, absolutely not. The last thing I'm going to do is get in front of the community, because I took the work very seriously, and I didn't want to set out false hopes. Like, what's going to change? We happened to have someone on loan to the city, believe it or not, at this time. This is during the Obama administration. They had a program called Strong Cities, Strong Communities. And a woman named Lynette McCrae, who was lovely, and she and I had a number of discussions about this, with her trying to convince me that it was going to be different this time around. I didn't believe her. I'm like, Lynette, you're nice. I appreciate that. And by the way, she was on loan to us from HUD to try to help us navigate the federal bureaucracy, believe it or not. But she kept working on me, and this was like November, December of 2014. And so one day I went back, and I talked to this guy. The guy on the left is my dad. He was a Air Force veteran. Two of my children, Dylan in the middle, AJ next to him. And why is this picture in there? I love showing off my family, number one. But more importantly, my dad was not just a veteran. He was, at the time of this picture, a recovering alcoholic. The first 10 years of my life was pretty miserable. Our family was in chaos. Dad stopped drinking in December of 1978, and my life, our family life, changed tremendously. I was young at that time. I didn't know a lot of what we were going through. I just knew we were a family in chaos. Later on, Dad would say, when we'd see someone homeless on the street, and I'd say, Dad, why do you keep giving money to homeless people? And he would say something like, but for the grace of God, there go I. And what he was thinking about is how close at times he was to getting kicked out of the house and not knowing where he was going to sleep because of our family chaos. So when I talked to my dad and was talking about the pledge, I said, Dad, I don't want to disappoint you. He's like, the only way you would disappoint me is if you didn't try. I go, okay. Don't want to disappoint my dad. So I said, all right, I'm going to do it. But if I'm going to do it, we're going to take this very seriously. So there's a case study. What did I just do? There's a case study, and I've got references here that Bloomberg Harvard City Leadership Initiative has done. And this is an excerpt from it. I'm not going to read it, but it essentially goes into me taking the pledge. And it describes this meeting. I forgot I had this. I just found this picture. This was my Instagram account back from 2015. I took a picture. Most HUD meetings, I would tell you, they're not very exciting, right? And I'm still shocked when I think back about how much of a charge I got out of going to this meeting, because I saw examples of what happened there is they gave an example of this by name list, and that's when the light bulb went off. Like, they're doing what this Marathon Health folks are doing. The by name list it's so simple, it had eluded us, right? If you're going to solve homelessness, you better know the name of every homeless person, and you better meet them where they are on their journey, which is what Marathon Health was saying. Hey, you're dealing with somebody who's got diabetes, other chronic disease, you got to meet them where they are and help them walk their journey. You got to empower them, and it can't be about you, it's got to be about them. That was the shift in mindset. And so we took the pledge in 2015. Again, the case study goes into some of the detail there, but I'm like, all right, we're going to build this system, and we're going to start, and we're going to get our by name list going. And that's when I started realizing all the resources I didn't realize how wealthy we were. We were always talking about what we lacked. It was this mindset of scarcity. But all of a sudden we realized that, hey, we're the community action agency. We run all these different programs. We could be the backbone agency and start managing this list. So that's what we did, and I'll go through a few steps here. The biggest shift was going from a sort of point in time count mentality. Everybody familiar with that, right? Once a year, January. I don't want to say it's a complete waste of time, but it's got marginal benefit, right? You get a one-time view, and that's kind of your guiding principle on your homelessness issue. When the population's so transient, got so many dynamic issues, one big global list of homelessness was not very helpful. We switched to the by name list approach, and this, by the way, Roseanne, I stole from your website. Hope that's okay. But just describing what a by name list is, and I've got some additional detail on ultimately it's not one list of homelessness. It's veterans, it's chronic, it's singles, it's youth. You start taking this impossible, abstract problem and you make it manageable by breaking it into smaller parts. I would say we were fighting over the wrong things for years and years amongst our continuum partners. Like me pushing, I wanted everybody on the same cloud-based HMIS system. It was foolish. It was not what I should have been wasting my time. What ultimately drove us to our success was getting the first alignment around a common vision was, let's do veterans homeless. And we by the way, this is an article describing what we did. The original data we were putting together, we thought the list was going to be about 50 veterans. And we kind of rallied around that. We could get 50 people housed in a year. Turns out, as we got better data, it was more than double that. We ultimately housed about 117 homeless vets by the time we reached functional zero definition in December. But having that kind of, we were able to rally around this manageable number and get the team starting to work and build the systems that we hadn't had before. So core strategies, the single point of entry, coordinated entry, we had already committed to that prior to the lead up to us taking the pledge to end veterans homelessness. So the city was that backbone agency. It was the single point of entry, coordinated entry. So we weren't the place where most homeless folks started. They may start at one of the emergency shelters in town. They may be taken to a hospital, and we were constantly, we were the largest metro community in the area. So we would have suburban, wealthier communities put someone in an ambulance and drop them off at one of our local shelters. And then they got to be admitted to one of our local hospitals. It was just chaos. I'm telling you, chaos oftentimes. But what started to create order out of the chaos was at least the city, we had starting getting one, HMIS identification on an individual. So we knew who the individual was. We had the by name list, and we were able to work that as a living document. We had the Housing First strategy, not by all of our partners, by some, but we added that in as a complementary strategy. So we might have a faith-based community that was dry, that had a large shelter, which they did, but that wasn't the only solution that we had. We started layering in multiple solutions. And then tons of outreach, and then public accountability, because every month we already had these, what we called our Rockstat meetings, which was our public, I ran these meetings. This was how we managed our city essentially. And we added in our work on the by name list and our efforts to end veterans homelessness into a monthly report that we would do at these Rockstat meetings. And those were open to the public. This is, I won't go through all the details here, but this is essentially our collective impact governance model shift. So moving from silos to having a shared vision, collaboration with accountability. And, I think the key for us was having the city play this role as the backbone agency to convene the partners together to make sure that there was going to be, ultimately, I didn't micromanage who was getting our grants. I didn't ever weigh in on that. Those were other people who were making the determinations on grant recipients. However, we managed the process that I think really empowered and freed up our really good organizations and our individual members of those organizations to do great work. All right. Geez, what did I do? All right. So that role, I would say the three functions of it: convening, facilitating a lot of the data and information exchange, then monitoring outcomes and reporting. This is really the role of the backbone for us. We had three layers of the governance model. So myself, I would be most of the time at what I would call policy leadership, along with other members of our community action agency. We had an operations group. This was the group that was looking at the list. And then we had tactical teams doing the street level outreach, developing the customized solutions. And that was, fire. We had a number of agencies that were involved in it that were under sort of our city management, including fire and police, our human services department. But that's also where our hospitals and all the community partners, the faith-based groups, were doing this is the hardest work, in my opinion. The most important thing that I did was just sort of validate and support this organizational structure that got us to move from being just a bunch of parts to a whole that was greater than the parts. Again, I won't go through all this, but this is just some more detail on how the collective impact model takes pieces like a by name list and fits it into a broader structure. And mentions here, we just use a Google Docs spreadsheet, right? We were getting hung up on millions of dollars being spent on HMIS systems, and the breakthrough was a free Google Docs program. Seems insane almost, but it was more than the program. It was the alignment that came from using that shared tool to keep everybody moving forward. And by the way, I didn't go to many of these, but I would say that the biggest difference in how we felt after we started this process from before is, in the old model, you'd go to these meetings with all of our partners in the continuum, and we'd be oftentimes pointing fingers at each other or pointing fingers at an empty chair of resources that we didn't have. Right? We need more of this. We need more of this. After we started the new model, collectively we pointed at the list. And it didn't mean that we had all the resources we would ever need, but it gave us sort of a numerator and denominator of homeless. Here's the universe of homeless folks, the denominator. Here's how many we've housed, and here's who's in maintenance. And it just gave a lot more positive energy and creativity around the work that our teams were doing. A couple of just screenshots. This was actually a screenshot of our by name list. it's HIPAA compliant data. Angie Walker, who was our champion superstar outreach worker, she shared with me a couple of these images and descriptions of the by name list work. But this is what the operations team would be looking at, and this is what I would look at. This was just essentially the dashboard, pretty simple dashboard, but essentially how we monitored at our public meetings, how we were doing. So this was the aggregated, de-identified data up here. But this helped keep us aligned and moving forward, because there was, again, some people think as a chief elected official, I have way more authority than I actually do. What kept us moving forward was the shared accountability and alignment from all of us working a common list, and knowing that if you didn't do your job, it wasn't going to feel good at the next meeting, because all your peers are coming together, doing their work. And so it kind of drove us all towards this idea of, I would say, very positive peer pressure. And we started getting out of that mindset of scarcity towards more of a mindset of abundance. Hey, we don't have everything, but we've got a lot. Let's make what we can out of what we do have. I'm not going to go through all this. This is just other components of our coordinated entry system. This is just some of the recognition that we started to receive. By the way, this is funny. I won't go through all the names, but when you're going through the hard work, not a lot of celebrities show up. Not a lot of, when you're going through the hard things like the deaths that we had, the tragic deaths, it's pretty lonely. When you're celebrating success, like we were in December 2015, everybody shows up, but it was fun. We had a great group of partners here from our different agencies, some leaders from the federal government that showed up to help celebrate our success. And I love this quote from your organization, Community Solutions. Rockfort's success proves that functional zero is achievable. No community can ever again claim that ending veteran homelessness is impossible, or that it cannot be measured clearly in real time. For a community that's been on all of the bad lists, we were super proud of this. And it's, them kind of saying, hey, if Rockford can do it, they're pretty messed up. You guys should be able to do it too. You don't do this kind of work for these kind of accolades, but I was also honored to be able to go to a White House celebration on our work ending veterans homelessness. And this was a New York Times article. Angie Walker, again, one of our champions, rock stars, is here. And this is actually a really important quote, because it exemplifies kind of what was happening and the change in these meetings. So I'll read you the quote. This was talking about how we were successful in getting a lot of chronically homeless housed. Quote, you have to figure out what's important to people, she added. Is it watching the Cubs on TV, helping them call their family? All that information goes into the by name list, and that's the big thing, making it personal. So this Cubs thing is an actual real story. We had somebody, as we were getting close to reaching zero, wouldn't accept help. We had a voucher, we had a chance to get them housed, but they wouldn't accept it. And somebody at one of our operations meetings said, hey, isn't he a big Cubs fan? Yeah, he is. Well, what if we got him a TV? And got him, and the deal was, hey, you accept housing, you're gonna be able to watch the Cubs on television. And by God, it worked. It worked. So, and that's really what, in my training now in healthcare, we talk about motivational interviewing and appreciative inquiry, really trying to find out what's important to a person and build the path around them and their needs, as opposed to the way oftentimes we did in the past was, we wanted them to come to us, not the other way around. I'm about done here, I think. Just, again, more recognition. That case study that I mentioned before, it's one of our homeless veterans, Paul Paddock. We were able to get housed. And just sort of a summary here. Lessons learned, I would say, looking back, things that didn't work, our 10-year plan to end chronic homelessness, our point-in-time counts, organizational silos, and finger pointing. Things that did work, adding housing first, our single point of entry, maintaining high community standards. We didn't allow, and we still don't allow, camping anywhere you want to camp, right? But what we said is, all right, here's our standards. You can't do this, but if you want housing, we're going to get you housed. Our HUD VA partnerships end up being outstanding. It wasn't easy. Oftentimes, we had, especially early on, unwillingness to share data, and we had to work through that, but we did. And then most importantly, I think, getting a governance structure that allows you to point at the list and not point at each other. couple more points, having a shared focus and visions. Again, early on it was veterans, and then it has become these other populations that we work on the data enhancements, the governance changes, and then again, the mindset change, I think, from having a mindset of scarcity to abundance. Got some other slides and materials in the appendix, but with that, I'd be happy to take any questions that you might have. Yes.
You deserve a huge congratulations. That's a wonderful story.
Thank you.
You said you housed 100 people. How? What was the kind of housing?
So it was a mix of
Maybe you could repeat.
yeah, I'm sorry. I'll repeat the question. So the question is, we actually housed over 100 people and veterans, and then we housed we got the chronically homeless population housed the following year. And I would say what was true then is still true today. It is a mixture of solutions. And I'm not the expert. And we have public housing experts, affordable housing experts, all kinds of folks who know the programs. We have faith-based communities doing certain types of programs that work for certain individuals. What I would tell you is I would occasionally get these kind of, once we built the process and we had a numerator and a denominator we were working on. Again, the denominator told us, all right, we got a list of about 50 that changed. Again, these numbers were dynamic, constantly being amended. But what it gave us are targets. And so like our staff would come to me and say, Mayor, we need 5 more VASH vouchers. And so could you put a call in to the VA or to Senator Durbin's office, Dick Durbin, our longtime senator in Illinois. That gave me sort of a specific, tangible, measurable request, which our partners were much more apt to respond to, as opposed to what doesn't work for years is we don't have enough of this. Well, how much more? We don't know. It's just not enough. We need more. You're not going to get that. That didn't work for us. And so we sort of took an all of the above strategy when it came to resource development. We were going to landlords. You have a harder problem, frankly, from the standpoint of not having available inventory. We had quite a bit of inventory of underutilized rental properties because we were just coming out of the Great Recession and had a lot of loss in population. But we still had to convince landlords to accept vouchers. And so the city, we had a working group working with our local landlords, and it was commitments from the city saying we're not going to leave you hanging. If you accept one of these vouchers, you can still evict someone, and we will help reimburse you if they trash the place. Right? We had to give them some assurances that they weren't going to just have these individuals left on their own who may not have had experience living in traditional housing for quite a long time. So it was, again, all the above strategy when it came to developing inventory that worked for individuals. But I would say in every case, what we really try to do is say, what solution is going to work for the individual that is next on the list.
Thank you.
Yes.
Again, congratulations on this. That's fantastic. Question on that program you had just mentioned, convincing landlords to accept voucher holders and the city, I'll use the word guaranteeing it. What type of success rate or issue rate did you have?
Yeah, it ultimately was super successful. It was very successful in significant part because, again, we had landlords who had an appetite for getting their properties filled with somebody that was going to pay on time every month, right? But for us to be able to pull them together, and I was involved on the periphery. I would have meetings with our local apartment owners association. I would try to promote from that standpoint. And I can't remember exactly how we did it. I could check into it. But essentially we were saying, hey, we're going to make you whole if something, God forbid, happens. If they trash the place, they start on fire, whatever, yep. Right? So we're not going to leave them. We had to build some confidence and trust that it was okay to accept folks into housing that might not. And again, like with the VASH vouchers and a number of the other tools that we're using, there was going to be support from a social services standpoint behind the housing. So this person wasn't just on their own.
Thank you.
Yep. Yes.
You used the term earlier, tough love, and that if people wanted to be housed, you would find a way to get them housed, but you were not going to allow indiscriminate camping. Did you have a big camping problem? And if you did and you had to address it, what were some of the strategies and what sort of legal obstacles did you run into?
So, really good question. So we did have camping. It wasn't as open as it has become in certain cities. Like, we never really had, I do a lot of travel for my work now, and we didn't really have people doing sort of open camping on the sidewalk or on our downtown. But we had, in some respects, maybe worse because it was out of sight and sort of out of mind. We had encampments that we were routinely, probably twice a year going in, taking them out or taking them down, that were notoriously, drugs, crime, just not healthy situations. So we said no to those. And they were, one spot that was near my first home that was underwater mortgage home, near our riverfront. It was on some railroad property, underneath a railroad bridge, right? So not an easy place to get to, older sort of industrial part of the city. And, but we had to get rid of it. I just met with our Angie Walker, one of our superstars, last week to touch base because I knew I was coming here. And I said, are we getting any more of that back? She's like, no, we've been able to maintain, we don't have the camps anymore. And I think and I would talk about this, especially like when we were going to that church and say, no, we can't allow you just to, because you're doing God's work, and we know you're coming from a place of what good intent, but we have these standards. This is our fire code. This is our building code. Unless it changes, we can't be, we can't pick and choose who gets to follow these rules. And so that's what made some of these conversations very difficult. But what I think we had to do morally, but I also think it's the law. If we were going to say no here, we had to say yes somewhere else. So that means, and again, I think every community's got to develop a resource pool that's got to be right for your community. But whether it means, for us, it meant we had to activate a lot of these landlords and vouchers and affordable housing resources that we hadn't been doing historically, which we were able to do successfully. And, if I had the market that you have in terms of the cost and the difficulty, we may have had to pick up and do some different things, more temporary. The most chaotic and dangerous stuff is people, unsheltered at night. So our rescue mission, faith-based group, dry, that's not, you don't reach functional zero just keeping people in a shelter like that, but it's better than people being on the street. So that's what, there's no perfect solution, but having the system gave us visibility and kind of where we were at any given day. We still have, the last number that I got, 135 homeless single people. We've reached functional zero for veterans and chronic. We still have singles, and a lot of those folks, it gets into the weeds and sort of the terminology and how you define the different groups. But somebody who just lost a job and it just got evicted from an apartment, that they may be one of those singles, right? So, and if we're doing things right, that list is probably going to turn over more rapidly, but we still got to find a place for them. And so, it's not a perfect answer probably to your question, but that gives you kind of a general outline of how we were taking it on. Mayor?
You've gone past it. Go right ahead.
Anything else? Yes.
I'm curious about the term functional zero. You mentioned the example of the individual who was lured in by watching the Cubs game.
Yeah.
That would have worked for me too.
Yeah.
What would your statistic have been had that individual or someone else just simply said, I understand what you're offering me, I appreciate the opportunity, but I don't want to participate or I don't want to follow your rules. What would that have meant for your success?
Well, and that still happens. I would never say we've solved homelessness. I would say clearly we've reached functional zero definition for this and this. Homelessness is never going to be solved as long as there's, humanity and we are the fallible people that we are. However, the definition, correct me if I'm wrong on it, Roseanne, is essentially we've shown our ability to rehouse within a 30-day period our average number of folks that would be coming into the system in a given 30-day period. So if you'd be having 8 people come in, you got to get those 8 people housed. And so you may have a number of around 8, and I think that may be our number. But we're hopefully getting them rehoused within that period. Now, sometimes from 1 month to the next month, is it the same person? Yeah, very well could be. Doesn't mean you're getting all these 8 housed, but you're managing to keep that numerator in, around that number. So you're getting them rehoused on a continual basis. And I think, whether the city might drop out in a given month, but it's always our target to get back on and just monitor that data. And, we're working from data that we never did before. It was the once a year point in time count. That was abstract list. There wasn't actual names attached to it. Today, when we say we got about 135 people, there's 135 names associated with that list. Yes.
So could you speak a little bit more about the governance model, how that worked and who was part of it? Or did that evolve or change over time?
Absolutely happy to speak on it. Probably the hardest part is the governance model. The data, if you're committed to it and you work with a smart partner like Community Solutions, can help you work through it. And they were super important for us building data integrity and managing that. The governance structure, again, for me, it was starting to realize what I already had. Part of the baseline is defining the terms. What's a continuum of care? You start talking to average citizens, they have no idea. And I didn't have any idea when I was first elected. It took me till my 3rd term before, I started, seeing how all the pieces kind of work together and what the city could do and what we can't do. I think getting, you've got a different model. You've got a separate, I believe, community action agency that's outside of your local governments, right? It's a nonprofit. That's fine. You just, I think, functionally have to determine you're going to have those 3 layers, however they kind of match up. You're going to have a policy level leadership, folks like elected officials. You're going to have operations teams. You've already got them, right? They're already out there. You've got people doing outreach. You've got firefighters, police officers. People are out there responding to medical calls, or a homeless person who's out in the middle of the street and seems to be having a mental health crisis. You've got those pieces, but the glue that tied it together was us identifying who's going to be the backbone agency that will manage the following functions: managing the list, convening the meetings, ensuring that we have data integrity, right? And then we as a city had some additional things that we had some resources. We had we had outreach workers, some of them at least, doing some of that work. We weren't the only ones. But the key functions, I would say, is the convening, managing the list, managing the data. It could be a shared person. You might have a project manager that multiple agencies say, hey, we're going to fund. This is going to be the person's responsibilities. And it's sometimes easier. Frankly, it was helpful to have Community Solutions come in the Built for Zero because they weren't local. Right? It's sometimes easier to have somebody from out of town come in and say, all right, this is kind of our neutral player is going to help us all kind of work together. But again, I'd say functionally, you've got to accomplish some of that backbone work. How you do it, that's going to be a mixture of what makes sense for your local community. Thank you. Yep. I would just probably finish up by just applauding you on your work, making this kind of commitment of time and energy, and being audacious and bold to say, hey, we can actually do this. That was the hardest part, I would say, looking back for me. I didn't want to do it. It wasn't because I wasn't willing to work hard, but I was at a point where I just was so cynical. I didn't want to fail. I didn't want to have another. I'd lost hope, frankly. It was my dad and my kids giving me a charge that kind of renewed my energy. And then, being able to, connect the dots. And I think a lot of this was a God thing. And it's frankly why I have my career, I think, in healthcare today. I didn't plan on it. I didn't know anything about healthcare. I didn't know anything about homelessness, really, when I was first elected. But sometimes we get on these journeys, and if we're committed, we can figure it out. So thank you very much. I'm happy to be a resource anytime. Roseanne knows how to reach me. Happy to share some of my business cards if you want to connect with me directly as well.
Thank you.
Thank you.
Thank you, sir.
Larry, thank you. And you know the timing of your visit couldn't be more providential. We have just, as a steering committee with lots of other support from many people here, gone through a planning process to identify our action priorities for making significant reductions in homelessness. Our horizon is the next 2 years, and we've laid out 5 different areas of work. And so we are beginning the process now of organizing working groups around these different lanes of work as we identify resources to hire the project manager that you just indicated was so critical, just to keep this governance, shared governance model working, and the moving parts. And so we're looking, and on the other side of the agenda, and you know, we've begun reaching out to folks to find out who's interested in serving on which working group, and these will also be open to members of the public who have interest in relevant skills. But our near-term goals are to end veteran homelessness, to reach functional zero veteran homelessness in Concord by the end of October. We have somewhere between 8 and 14 veterans who are experiencing homelessness here, and especially inspired by your work. You had, I think you said 117 veterans identified and housed within a year. So that's our target here. And then maybe one of the, and this will be happening simultaneously, one of the key things we identified in our process was the need to create a common operating picture, which would include a by name list, but also just the habits of bringing everyone together to see the same picture of the issue. We understand from many folks in the community that making all of these efforts and our progress toward our goals visible and informing community residents about how they can plug in is one of the key tasks. And so it might be helpful actually to hear a bit more from you about how you communicated with the public. We also know we need to increase housing opportunities, and that can take a number of forms. We right now have probably 24 unused vouchers, and it's really how do we really take friction out of the process for getting folks connected to housing and bring more landlords on board. And that our goal over the next year is to reduce unsheltered homelessness by 100, which again speaks to knowing people by name. That would 25% of our overall number, so 100 represents that. And we have just terrific assets in this community, especially people who care deeply about the community. And we have just a number of organizations represented here on the committee and who've been part of this process, who I think are really quite ready to put our thinking and our work together in new ways. And so maybe in light of those priorities, I think maybe if you could say a bit more about the public communication and getting a wider array of actors in the community involved. We've identified certainly the landlord community, the business community as maybe untapped resources or folks who need to have kind of more of an explicit ask, and for us to understand what will be important to them.
Happy to comment on that. So we had, as I mentioned, this public process called Rockstat. That was my sort of built-in, discipline for communicating and holding myself and our team accountable. So every month we would review the list. The current administration, I left office. They don't do it quite the same way anymore. But I think it was important for us when we were first getting started, to kind of your point, to rally the various community partners and keep us aligned. I'm always somewhat concerned today that, you don't want to ever lose momentum. We've got good momentum, progress. I personally like having that sort of public check-in. It doesn't have to be every month. Maybe it's quarterly, but as an organization, are you and collective, are you holding yourselves accountable? Now, I was committed to doing that, and had the bully pulpit to do it as mayor, even if the Continuum didn't want to do it, because frankly, if I just asked them at the outset, "Do you want to do this?" the answer might have been no. Why? Because it's scary. But we had gone through that early on when I was first elected, when we said we were going to do this public process to hold the city management accountable. I was getting pushback from my own department heads and leaders. We're not ready. We're not ready. We're not ready. And we finally just said, we're starting next month with whatever we have. So the data wasn't perfect. The systems weren't perfect. It was clunky, but guess what? We got better every month. And that continues to occur. So I would just say, the doing something beats doing nothing. And having an imperfect list. Our list it's never perfect, right? Because it's changing. You're learning. People are moving in and out of the community. So, you don't always know, you try to get as close to real-time data as you can. But whatever we were doing, beat the heck out of our point time count, right? And then once you've got that bully pulpit, you can start bringing in community partners. And by the way, community partners tend to show up more when there's a little bit of success than when there's not, at least in my experience. Like I said, when the only news we had was petitions and fights at City Hall and, sadly, those deaths that I had to reference that article around, it's pretty lonely. When we started getting successes, more people show up, you start building some momentum. And I think that would be, if you got a need to bring in landlords, you may have an opportunity for city, county leadership, for your economic development groups. If you've got an apartment association like we did, I'd bring them into my office and have some conversations with them. And ultimately, you're not forcing them. It should be a benefit for them if they've got somebody who is going to guarantee to pay them rent every month, right? So, that's kind of a long-winded answer, but hopefully I think creating a platform and consistency is key.
I mean, one of the things that we've been hearing, and your advice is really so appreciated, is that we need to make the community aware that we have a plan and how we are working the plan and the movement toward results. That, one of the things that is so frustrating for people doing the work, and we have amazing outreach and other organizations, is you have many people in the community thinking that nothing's happening. Sure. And so we want to change that story, and that's part of what we're thinking about as far as the work of our communications and public education group.
One thing I just thought of because I'm guessing this may be going on because it happened certainly in our community. It's happening. I see it all over the country. If you don't have a platform to have these conversations about what's going on, people are left to just guess. And so sometimes you'll get people who will confuse panhandling with someone being homeless, and then start association, crime and poverty, and then this could be a snowball effect of really negative community energy. I think it's better to get data and information out there, show progress, and starting to address some of the underlying mythology that might be out there around what we said on the tough love issue. We didn't allow chaos. In other words, just random camping, violent or inappropriate panhandling. We had to say no to certain things, but we said yes to other stuff. So it started to help us get a little bit more positive messaging around our work, and there was a lot of substance to celebrate around the work.
Well, maybe we can go into a bit of reflection on, especially among members of the committee and anyone who certainly needs more time to think about it, but we'd be curious to know, as we constitute these working groups, who is interested in playing a role in which group. And we want to get into a cadence of meeting on a regular basis as we look to bring the project manager on board. That's certainly an important enabler of all of this volunteer effort. But just to get a flavor for what is going to be most interesting to members of the steering committee. Now, I've spoken with Robin and Laura about some of their interests. I know Robin is game, as is Laura, to be part of the public education and community engagement work. But I'm curious if others have had a chance to give some thought to this or would like to have some more time before committing to being part of one of the groups.
I'm open to wherever you want me.
Okay, great. Thank you.
I think I'd go with public education.
Okay, great.
Yeah, I think that's kind of that would be my spot too, I think. It's my sweet spot.
All right.
I was
Peter?
looking at communications, but that seems to be taken pretty well. You can put me in the operating system, please.
That sounds great. Interestingly, and this came up strongly, we have in Concord, one of our great assets is we have just a tremendous and well-trained and skilled emergency management infrastructure here with the fire department and police, and we think that is capability and infrastructure and that we could be calling on in this kind of slow burn emergency that is just in speaking with the chiefs, like if 500 people became homeless because of a building collapse in Concord tomorrow, what would we do? We would actually constitute some of these collaborative, data-driven, solution-finding structures. And so, Peter, your background in quality improvement and data would be really helpful in putting that common operating picture together and how we actually move in this kind of different kind of crisis, but using those kinds of those tools and skills. Tim, could we recruit you to be part of the housing outreach as well as Tom? Just trying to connect differently with landlords and different housing solutions.
Possibly, I would have to understand exactly what that would entail.
Yeah. Part of it is we have to figure it out together because I think, as Larry said, we don't have a vacancy rate, much less a high vacancy rate. So I think to what degree are there landlords who maybe have units off market or have reservations about using vouchers, and what would it take to, kind of reassure them that they're not going to be left hanging? Where do we need some new supply? We know we have a lot of new development happening in the community, and some percentage of those units have been pledged to low-income and formerly homeless individuals. But I think we're going to need some infrastructure really to coordinate that and make sure that process works well. So those are just the things that people have mentioned. But I think this is a moment for creativity.
Okay. Yeah, I'm happy to work with Tim on that. And,
Okay.
I'll just, what was interesting is how you said the city, I'll use the word guarantee again, city guaranteed to landlords. That's always the issue. A voucher is one thing, and what you'll find and what we found is if you have affordable units, it comes with a lot of regulation and compliance. And what we find is 90% of these individuals don't qualify. So they may have a voucher in their hand, but they don't qualify for other regulations, so we're not able to house them. So that seems to be the issue. So the city guaranteeing the damage, the eviction, and the voucher guarantees the rent, so to speak. That would, I can see where that was huge to help convince private landlords to take this on. So
Was that through the city, Larry, or was that through your continuing care organization?
Yeah, it was really both. It was me personally getting involved in some of the conversations, and then I can't, I don't remember how we did it exactly. I think our housing authority maybe came up with sort of this strategy. It was a good friend of mine, our housing authority director, saying, "Hey, let's just have a bucket of resources available if we have to help fill in a gap in order to get, make someone whole if there was an issue." We're not going to be an insurer, so to speak, if somebody, place burns down. But if you get the type of stuff that you would typically get when somebody's abusive to a unit, and I don't even know if we had to use any of the funds, but it was that pledge of just being sort of putting our commitment behind the project that seemed to be helpful. And again, we had landlords that were more interested because we had a pretty high vacancy rate at the time. Again, we didn't have the issue, frankly, that you have with where you have such a low vacancy rate. Actually, by the way, the Wall Street Journal recently did an article on Rockford. We're doing a lot better when it comes to our underwater mortgage capital thing, but it's not because the economy's going gangbusters necessarily. It's just because nobody's built homes. The housing market has been, which I know can be an issue across the country. People can only pay so much. Costs to build a new home's gone up. So, you start getting that squeeze, and that's an issue that we see all over.
So I put my name by the veterans.
Why don't you describe what you're hoping to
So
launch, Jim?
I don't know if I took the easiest one, but I went to a meeting a couple weeks back, a month or so ago, and somebody said that there were 8 veterans who are homeless in Merrimack County, 1 in Franklin and 7 in Concord. And it was a little different than some of the data I'd seen at Concord Coalition and Homeless and some of their lists. But I said, damn, we could do that. You know, we could do 8 or 7. So anyway, that's why I signed up for it. But some of the colleagues from the state are here serving the veteran community, and I think Harbor Care, Veterans Inc., the VA, the Easter Seals, the state folks. There's just, I think, a lot of goodwill in that effort, and I think we have to follow the same approach: is what's the list, by name list, and then work the list regularly. I would hope, and then try to reach out to the landlord community and say, hey, we need 8 or 9 or 12 or whatever it is, saying these are veterans, they deserve housing just as everybody does, but can we help these specific individuals? So I'm hoping if we get that really, I know there's case conferencing going on at the state level, because a lot of those agencies work, VA and others work at the state level, but if we could get a really focused Concord area conversation going, I think we could nail this.
Can I just share one other point I just thought of that? So Angie Walker, when I met with her last week, she shared something that I thought, as I'm thinking about it now, might be important to share. So when we would have these by name list meetings, they were in person. During COVID, they went to virtual. They've just recently came back to in person. Why? Because she told me that we were starting to get sloppy. People not showing up or turning off their cameras. And they decided as a continuum, it's important that all of us maintain the level of accountability and commitment that got us successful in the first place. So as you're thinking about all the different partners, at least initially, I'd encourage a lot of the casework to be in person.
Thank you. That's great.
Maybe, Larry, you could say a bit about the role of veteran service organizations and also the state in supporting your getting to functional zero and then maintaining it over all of these years.
So I'll share a little bit of my perspective, but I would say the hard work was done by my staff and the staffs of the respective organizations that had to do more of the day-to-day work. What worked for me was being able to, and by the way, our governor just recently, I think it's during his last State of the State address, recognized Rockford for some more continued success in homelessness and sort of setting a model in place. But some of my calls to the state would be, or with other partners, might be, to be very blunt about it, the governor, when we have the Department of Corrections dropping off ex-offenders, returning citizens, but they'd never lived in our town. So why are they being dropped off at Rockford? Because we have a large shelter. And so part of what, I think there's mutual accountability amongst all the partners was me getting a call because there's been a crime and it was a homeless person and the person doesn't, got dropped. It was a person whose life was set in a trajectory of failure by some of our resource partners. So having the ability to say, hey, there's accountability across the board, and I've got a role as mayor that I have to make some of these calls, and those aren't always fun calls, but I would do them when I have to. And then it might be, like I said, to the senator's office if we needed help trying to convince the VA to get a few more VASH vouchers or whatever it might be. But a lot of times it was me being, us building the core, and that made the request manageable. Again, we had a specific issue that came up. We want to ultimately make sure all the partners, hey, we never said we wouldn't take someone from the Department of Corrections, but if somebody's going to be coming in, we want to have a game plan, right? We want to actually have them following the rules about ensuring that they've got a place to stay in a way that's going to be successful. So there's so many different buckets of activity. We had a whole separate jail reentry program, right? There's these different categories of homeless. The thing about homelessness, it's so complex. if you take the mindset that you have to solve every piece of it, you'll never get anywhere, right? You got to start with the list and kind of work backwards. But we have a number of different initiatives going on at a given time, and then my staff would team me up and say, "Hey, we need you to make this call. We need you to make that call," and that's essentially how it worked.
And may I? And what you started off with a population health model that sort of gave you the insight that having a list, a by name list, could really help you manage it. Back to the healthcare, did you have specific healthcare issues or services for your homeless folks? We've noticed here that sometimes medical respite, a homeless person ends up in the hospital, needs to be discharged, would be discharged to home if they had a home because they could take care of themselves or get V&A, but they don't have a home, so they need a place besides the street to be. I don't know if that issue showed up.
Oh, it comes up. It actually just came up in my conversation with Andrew Walker last week. We're trying to get some funding for essentially the respite category, which we don't currently have. Now, we kind of make do with what we have. So ideally, someone has if they've already got a voucher and they've got case management and other service support with it, we may be able to get something worked out, whether it's with a visiting nurse or it's some other, they may be Medicaid eligible or Medicare eligible, and so we can help manage that process to make sure they're taken care of. But that category specifically of respite, we don't have that as a specific feature right now. I would say our teams do their very best to try to fill in the gaps where they can, coordinate care with the hospital. We're dealing with healthcare issues all the time, behavioral health issues, crisis issues, and it's super hard, as I think probably everybody knows. We just had a horrific case, made national news. Unfortunately, a couple of them where, somebody who's going through mental health crisis ends up being taken from a mental health center to the hospital emergency room, and getting discharged from the hospital emergency room, and then and I don't know all the circumstances around it. There's articles you could read, but then committed some horrific homicides in town, and the whole story on that's still kind of emerging. But you've got, this can be super difficult work. So I would just say, and you have to have some. I'm assuming all of your teams are very acutely aware of the connection between mental health and physical health, but it's super hard, right? And so I think having sort of, we had a triage facility that we created in partnership with one of our local mental health community hospitals that we could bring people to, short of bringing them to the ER or to jail, right, for some instances. So that's been a really nice feature. But if someone actually needs, some care short of going into a nursing home, it's we haven't figured it out yet. It's still a project.
Thank you.
I'm curious, Larry, you described what the meetings among the providers used to look like, a lot of finger pointing and scarcity mindset, and then the kind of problem-solving culture, looking at the list and working the problem. What was the before and after of the role of your hospitals and also the role of your business community? Like, it seems as though lots of groups moved into new roles as you move toward this very disciplined approach.
Yeah, so I think, I sat on a lot of committees as mayor, and from my standpoint, going to the meetings, and I would interact with hospital leaders all the time and other business leaders all the time, and usually it was me pointing the finger at them or them pointing the finger at me saying, "What are you going to do about X?" Right? Again, the aggressive panhandling or the homeless camps or whatever might be the issue, and frankly, a lot of that stuff died down. Still had issues, but the breakthrough, we didn't really hit that 3 tiers of governance that I described. We didn't really have anything like those operations meetings before. Again, we would get people are together in this room and have meetings like this all the time, but we didn't have a meeting working a list like that. There might be anecdotal stories being shared, but you didn't have any sort of thing like that where you're actually doing essentially collaborative case management. What are we going to do to help this individual get housed? Who's got the lead? Who's doing outreach? You know, who's got a voucher, and letting those creative kind of discussions develop. And you don't do that overnight. Those meetings, you know, take time. You got to start somewhere, but you start working that list, and that's that really was the breakthrough. And again, I didn't go to most of those meetings. But those our hospitals did. You know, we'd have representatives from all the key organizations, including city fire, city police, city human services, our local housing. We've got actually that case study gives you an idea of kind of who were the key partners that participated in those meetings.
Great. I'm wondering if, you know, before we wrap up, if there are any folks in the audience who had a question for Larry or anyone here. Or advice.
Or advice.
But,
You talked about, just if I could,
Sure.
Ward Perry, I'm the Deputy Commissioner for the New Hampshire Department of Military Affairs and Veteran Services. So you talked about single entry. In the state of New Hampshire, we really don't have that kind of mentality of single entry. We kind of look at it as no wrong door. So anywhere you enter the system, we kind of try to get you to the right resource. Are those things synonymous or a little bit different than what you described?
I think it's similar. You know, coordinated entry, single point of entry, it essentially just meant, hey, the city, no matter where somebody comes in, we've got to make sure we bring them into and get them on the list, essentially. And so once they're part of the list and part of the collaboration, nobody falls through the cracks at that point. So they're again, most people didn't start by coming into city. People don't know where our office is, right? They don't. They have to be told, and you know where it is, and or if they need to go there for services. But in many respects, it was a. It's sort of a. It's a strategy. Whether or not somebody actually goes, shows up at this one place, it's the commitment that the city's going to manage this, and we're going to be the, as opposed to the old way, which is, we didn't have to send you anywhere. You were ours, right? And there was almost a mentality of, this is our individual client, right? And we own them. And it ended up being insane because then you're in a position of not necessarily, that's the scarcity mentality. We need to keep them, they're on our list. And then, we get in these fights over, are you double counting? Like, whose person is it? And there was just no integrity of the, so it was, having the single point of entry, coordinated entry meant that the city, and again, it doesn't have to be a city, it could be whomever, is managing that process to make sure there's integrity on the intake and integrity on the management of someone throughout the, however long they're in your community, right? Maybe the rest of their life, maybe a couple of weeks, whatever it is, you're going to have sort of integrity on the management of that that intake and the lifespan of whatever that individual might be within your continuum's work. If that makes sense.
It's perfectly nice.
Yeah.
Thank you.
Great.
And again, I wasn't the person doing it on a day-to-day basis, and I'm happy to, Angie Walker, who is, I mentioned her name a lot. She's still there, and I'm sure she'd be happy to jump on a call or whatever anytime to give you more of the details of how it works.
Thank you. Any other questions? Well, before we wrap up, I was going to ask Jim, who's been working on our Concord by name list with many of the organizations here, and to give us an update on the level of quality of our data and what we think we're really facing.
So our by name list, I work with my partner in crime, Connor Spurn, out in the audience from the Concord Coalition to End Homelessness and others. So we count everybody who's in coordinated entry in Merrimack County and add to it anybody who's in the past 90 days has come many times to our resource center, but who may not have been entered into coordinated entry yet. So we add those numbers together. In the past months, it's been increasing. It's increased about 100 over the past year, up to as many as 521 or something like that. But all the agencies involved are now involved in an effort to really clean up the list, because we worked pretty hard to get people on the list, but we weren't getting people off the list if they got housed, they passed away, or we hadn't seen them in 90 days. So I think some of the agencies are really doing that cleanup. And this past month we ran the list and it's down to like 321 or something like that. So, and we're still, the numbers aren't perfect, they're inexact, but it's even sort of more manageable than I thought. We thought, oh, we're not Manchester, we're not New York City, we're not California. We can do this even if it was 500, but if it's 300, it's even more manageable. And then when we go to the veteran number, it's even a small nugget. So I think cutting it down into population segments or bite-sized pieces makes a lot of sense because we could figure out some small things. But my understanding, and Connor, you can tell me if I'm wrong, but it's about 300, a little over 320, something like that, total homeless in Merrimack County. And we don't have city level data. We don't have quite yet have zip code level data, but we can break down from our HMIS the data into county level data. So that's because, as many of us know, Concord is part of a balance of state continuum of care. So we're not a continuum of care by ourselves. So we collaborate with other, or participate in the balance of state with other communities across the state. So I think that's our best number. Thank you. I got the thumbs up from my partner.
Well, so appreciate your being with us, Larry. Jim, thank you for arranging for Concord TV to record this for members of the committee and others who weren't able to be here. Hard not to hear the story of Rockford and be inspired, especially since as we really nail the specifics of who are we talking about, who are these individuals and the numbers and get closer to what each of their needs are. It just seems immensely doable, hard, but far from impossible. And just grateful for this committee and the support we've gotten from others in the community to lean into these specific lanes of work, which we think will move us forward.
Amen. Thank you. And then our next.
Thank you very much.
Thank you.
Oh, and next meeting, just for, let's see, we have Tuesday, August 13th. We've gone to more frequent meetings, and I know it's not the best time of year for folks with holidays, but those of you who are in town, we look forward to seeing you on Tuesday, August 13th at 2. And we'll be in touch with all of you about the working groups and how to get those up and running and what's going to be manageable. Thank you all.
Thank you. Thank you. Thank you.